Hello, my biohacking bestie. I'm so grateful you're here. So happy you're taking a moment out of your day to educate yourself and to listen. And honestly, I really am touched by you, your words, things that I hear from the community. I never thought I would be in this space and sharing so much and helping so many women because I didn't realize how lost we all really were. So this episode is for you. And I just want to take a moment for a little bit of gratitude and thank you. Thank you for your reviews as well and sharing with your friends. So you are amazing. Don't forget that you are amazing. So this is our third recording together with Dr. David Rosensweet. And we always take such a deep dive into many of our questions, like never get through them all. In the last episode that we covered, we talked about the best delivery methods for hormone therapy because there's creams, gels, patches, injections, so much out there. And we talked about, is estrogen really bad? Well, there's a spoiler alert. No, it explains why. And we talked about what's inside your gels and creams and what are you really rubbing on yourself? And that matters. And he also shared how to find a menopause doctor. We also talked about that today too, get some great tips on how to do that. And we also talked about when to start taking hormone therapy and that window of opportunity. And this time we had a surprise last minute guest who I literally just met during the recording, Dr. Holly Papanek. And she's a board certified internal medicine doctor. She's been treating women in menopause, and she's also trained under Dr. Rosensweet's menopause method from the Institute of Bioidentical Medicine. And I'm so glad I accepted her. It was just the day before, and they asked if she can come on. And I trust Dr. Rosensweet. So I was like, looked at her profile quickly and said, she's good. And she was really great. And I'm now scrambling to just find more information about her and how she can share more of what she knows. So I'll get that to you. But what I do know is that she's a physician. She's been practicing in both hospitals and nursing rehab settings. And that's for nearly 25 years. And that really means that she knows what many of us may look like in our 70s, 80s, and 90s. And lucky us, she also trained in the menopause method program with me. And again, this time we never have enough time to cover all my questions. We covered only like 3 or 4, but we take deep dives into them. And we took a deep dive into breast cancer risk and hormone therapy, just because this is always one of the biggest concerns that women have. And let me tell you, fear no more. And what really honestly, what we should be fearing and be most concerned about for breast cancer risk is obesity, alcohol, birth control, and smoking. Okay, those are all modifiable risk factors. We can do something about that. And of course, just getting older, age, our genes and dense breasts are also big risk factors, but we can't really control that. Although maybe if reversing biological age counts, then we can control that too. But I really want women to take a step back, get a perspective here in terms of hormones and really understand what those risks are relative to other things that we really should be paying more attention to. And in this episode, we also covered the myth that taking the lowest dosage of hormones for the shortest period of time, and as well as the most important questions that you need to be asking your doctor when you want to have that discussion about hormone therapy. So he really prepares us, and so does Dr. Holly, on how to get into that first conversation with your doctor. Because unfortunately, most doctors are not trained in menopause. And this is changing. There's Dr. Rosensweet doing this thing, trying to educate as many doctors as he can and health practitioners. And then there's a ton of these services that are coming out. There's things like they're called Alloy and Meaty, and we're going to do a podcast a bit on those as well. And so it's good we're having this conversation. It's good we're spreading, but we're still so far behind. I hear most of the women who tell me about their experiences with their doctor are not really good. They're pretty much getting denied what they want or not heard or given the wrong kind of hormone therapy or not guiding them the way they really should be. So I'm really happy I'm able to guide some of those women and tell them how to approach their doctor and keep that close line, and teaching them how to self-titrate with, of course, the informing their doctor as well, to be able to get to where they need to be in between those visits. Okay. And there's so many other things that we can do other than hormone therapy too. So it's not for everybody. Not everyone can take it or wants to take it. So whether you're on hormones or not, there are a lot of things that we should be doing to be biohacking our menopause experience. So we really need to educate ourselves so that we can make the best decision for each and every one of us. That's what biohacking is about. We're bioindividuality. We're all different. And the more that you know about your body, the better off you are, and helping that doctor guide you to where you need to be. And there's plenty of things we can do without a doctor too. So what can we do? All right, to get empowered and educated. So you listen to the podcast, it's going to be awesome. There are other podcasts that you should be listening to. Karen Martell is one of my favorites. We did a couple of podcasts with her, got another one coming up. And on the hackmyage.com website, you've got freebies, tons of free resources. I have menopause resources, where to get your information, how to find a menopause doctor. Those are great places to start. Which podcasts to listen to, which the ones I listen to, which books that I'm reading. You can also join the Biohacking Menopause group. This is our private women's only support group where we get in doctors, researchers, experts in biohacking, menopause, and hormones for live question and answer sessions, right? It's not like given a slideshow, because we can do all of that on the podcast. And then what happens is after you put the podcast, you go, hey, I wonder if this applies to me. I wonder if my situation is like that. And that's where you can approach Dr. Rosensweet and Dr. Holly, for example, who are coming on for a live Q&A. So please join this group, because these doctors are either unavailable because they're not practicing, or they're untouchable. Their costs are exorbitantly high, and we could never afford to actually see them, because they're really not, some, not Dr. Rosensweet and Dr. Holly, but other practitioners who I interview. Sometimes they're on a mission for something else, and they just don't have the time to take one-on-one. And sometimes they're out there training their other doctors, like Heather Hirsch, for example. We did a great podcast with her. I think she's like $700 or something, because she's got to train other doctors. She's only so much time in the day. So of course her costs are going to be very high, because she'd prefer to get more doctors out there than just try to suck everybody for herself, right? So anyways, join the Biohacking Menopause group. I have a link to that in the show notes. And another cool thing about that group, not only apart from just meeting other women who are on the same track as us and sharing our stories and sharing what works, what doesn't, because there's things that work for me, great, I can share it. There's a lot of stuff I don't know that other women out there have tried and they work or they don't work. And it's a free, safe space that we can use to know that we're not being judged, and nobody else is out there judging us and looking at us. So I think it's quite nice to have that space. And every month in that support group, we also have giveaways. We, again, as a podcast host, I am able to get in not only these amazing experts, but sometimes products, okay, that can be shared as a giveaway. And that's really nice. So sometimes we have giveaways where we can give like 5 of something for everyone. Sometimes I give away things for new members. I can give away plenty of stuff for each and every member who joins. And then we have this June, if you can join in before July 1st, we've got Karen Martell's facial hormones. Okay, this is a cream for your face that's got estrogen in it. It's called Estro 2 Rejuvenate. It's got estradiol and estriol, and it's for our wrinkles, our pores, and collagen. And because she's in the biohacking space, she doesn't want any garbage in there. So there's no nasty preservatives. She's got things like shea butter and coconut oil and olive oil, and I trust her 100% of having a really, really good product. So I'm giving this a go and having it sent to me so that I can try it myself, and I'll be sharing what I think of it. But join the Biohacking Menopause group before July 1st, and you'll have a chance to win that. And then what else can you do? You can also ask your girlfriends. You can talk about menopause, what works for them, what doesn't work for them. Are they on hormones? Are they not on hormones? Do they have a good doctor, et cetera, et cetera? Please talk about it. And the last thing you can do is just get trained in menopause, like go for a little bit more structure. And there are two programs that I've been through, and I think they're really, really good. And of course, it's the Menopause Method program from the Institute of Bioidentical Medicine. You can go there. I have a link to those sites on the show notes. Ask for a 10% discount using the code ZORA. And that one is a program that's really geared towards training doctors. Okay, so if you're a health practitioner, if you are prescribing hormones, definitely you got to do that one. And if you're not, if you're like me, you're maybe you want to enhance your practice, whatever it is that you're doing, you're in wellness and health, or you're helping women, it's also a great program to understand how hormones work. And it's not only about the sex hormones, but we talk about thyroid and DHEA, and we talk about a lot of other things in there. So it's a really comprehensive program. I can highly recommend it if you're serious about this. The other program I did, which was super valuable, was Dr. Stacy Sims' Menopause for Athletes. This is a program that talks about menopause and the challenges and how to overcome them if you are an athletic person. And an athlete is anyone who does some sort of planned exercise. If you go for walks every day, if you go to yoga class, if you go to the gym 2 or 3 times a week, you're an athlete. Okay. You're doing some kind of planned exercise. And that spectrum goes from there till, you're running marathons or something. So it's not just for professional athletes. This is just for people who like to be active. And that program blew my mind, the things that I learned, because Dr. Stacy Sims is all about the research on women and how certain trends in the health world, like keto or fasting and all these things, may not be the best thing for you. Okay, so if you are a woman and if you are a little bit athletic and if you are in menopause, so I don't have a discount for that, but hey, maybe ask one, tell them Zora sent you, and maybe they'll give you something. Who knows? And I think they have a Menopause 2.0 program coming out too. So, and what these are like cohorts, like you do this together as a group. I don't think it's like an evergreen where you can come in anytime, take your time, like the menopause method. You can start whenever you want, go at your own pace. With Dr. Sim's program, it starts on a certain date. They accept only a certain number of people. And I don't know if there's a finish date, but I certainly went through it really quickly. And I have a great podcast that I did with Dr. Sims that I'll also put in the show notes. Brilliant, brilliant talk with her. And what else? There's other certifications that you can do and trainings and programs. I would say if you're not really cared about being certified or how that superstructure, go to the Menopause Society. It used to be called North American Menopause Society. Their website has a lot of information, the British Menopause Society, and there's all these kinds of webinars and things. To be actually certified in those types of organizations, these official government, I don't know if they're government, but they're official organizations, you got to be a doctor to take their certifications or programs. And that's no fun, right? We can't get that information. So we got to go to other places. So there's a ton of stuff out there. I did those two programs. I'm really happy with them. I learned a ton. You will too. And Heather Hirsch, I interviewed her, Dr. Heather Hirsch. She's got her own program. I haven't dipped into it. I'm assuming it's good. Wise and Well, these women also know a lot about hormones, and they've got some programs out there. Again, I haven't gone through it, but those are two others that I'd look into. I've heard about the one Girls Gone Strong. You can skip that. I think that's pretty, I don't know. I haven't heard fabulous things about it. And then there's another program, I think it's the Canada Coach Academy. They got this menopause certification. They're still on old school information from the Women's Health Initiative and poo-pooing hormone therapy, and they're just not up to speed. I was really shocked when I heard that. So there's some of them you want to skip. And if you have any doubts, just get in touch with me and let me know. So let's talk a little bit about who's coming on, in case you don't know who Dr. Rosensweet is and Dr. Holly. Well, Dr. David Rosensweet, he's a medical doctor and he's been treating women in menopause for over 30 years. He's the founder of the Institute of Bioidentical Medicine and the Menopause Method, which by now you've all heard about because this is the training I went through and I'm always raving about it. And Dr. Rosensweet, he also wrote 3 books on the subject of hormones and menopause, with the latest one being Happy, Healthy Hormones. And you can grab this book because it's free and it's in the show notes and it's on my menopause resource pages and the Hack My Age website. And if you have been spending any time at all in this menopause space, you probably have already seen Dr. Rosensweet speak because he's been traveling the world. He lectures on the topic of hormones and functional medicine. He's a functional medicine doctor. He's been doing this for decades when it was not fashionable at all. And he's also been on a ton of podcasts by now. He's just a true pioneer in this field. And he's the one who trained the first nurse practitioners in the US. And he was in charge of the health promotion for the state of New Mexico. And now Dr. Rosensweet spends most of his time as the medical director of the Institute of Bioidentical Medicine. This is where he trains those medical practitioners to specialize in menopause and andropause medicine. Andropause, that's menopause, right? Menopause for men. That's when they lose all their hormones. So yes, it happens to men. It's just different. And honestly, I think he's like in his 70s now and he can retire, but he doesn't. He just keeps educating and following his mission to help women in menopause. And during this time, like he could go play golf or relax or do something, but he doesn't. I have so much respect for this man. And when I first met him, I had no idea who he was. I was like totally skeptical when he came on. He was this man telling me about menopause because I have this screening call that we go through, and I just opened it and yeah, yeah. And then I was listening and listening and 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 he just blew my mind. I was like, okay, this guy is definitely knows his stuff and we're on the same page. And and but I knew that there would be other women just like me, a little skeptical. I'm a man talking about menopause. So I invited him. I had him invite I had him invite Jill Chmielewski, and she's a nurse practitioner who is also trained in the menopause method. And that was sort of our female bouncing soundboard to sort of bring a woman's voice in there. And it's, I have to do these things because just that's the way we are, right? And I think by now, if you've heard Dr. Rosensweet speak, you get it. You get what he's all about and how brilliant he is. So now we can do episodes with him alone. But now we have Dr. Holly on with him too. So, and also what I didn't realize about Dr. Rosensweet, that he's really huge in this world of menopause, and it's an absolute honor to host him for you. So I know you're going to love this episode. So sit back and enjoy the ride. All right. Well, welcome. And I'm super honored to have on for the third time Dr. David Rosensweet. And now we have joining us Dr. Holly Papanek. So welcome, both of you.
Thank you, Zora. Good to see you again.
So I already introduced in the introduction all the things that we covered in the last episode, so much. And I'm going to have links to those, of course, in the show notes. But so let's jump right into the rest of the questions that I have. I've got a ton of them. And I'd like both of you to pipe in whenever you want. It's super casual. So we're going to start with the thought on the recommendations that we may hear from these menopause societies or from elsewhere, that women should be treated with the lowest dosages for the shortest period of time. So perhaps we start with Dr. Rosensweet. What are your thoughts with those recommendations?
Wrong. Next question. Let me
Wrong.
elaborate, actually.
Why?
That was someone's fantasy. There was no science behind it. 18 million American women were on hormones. 40% of all American women in menopause were on hormones until 2002, when a false reporting of a study came out that scared everybody falsely, gave the opposite of what was true. scared people into thinking there was risk for cancer when actually risk was reduced. But it spread like wildfire, and 18 million women on hormones dropped to less than 2 million.
Crazy.
And those 2 million women had experienced varying levels of duress where they didn't care what the risk was, what the false risk was. They needed help. And so someone invented, I have no idea who did, well, take it the smallest amount for the shortest period of time. And,
It's
and it
crazy because
was
that's
totally
a
invented. There was no scientific background. It was just like someone using what they thought was common sense. But I'd like to say that that's not so.
Mhm.
That's not true. Um, and all you have to do is talk to someone, a woman, for example, or a man for that matter, who's been on hormone replenishment, has gone into beginning from being very symptomatic with life-stopping symptoms, can't sleep, mood, vagina, or in the case of men, lost their erection, stuff that really matters. And then they get the hormones replenished and they get back on the horse and feel good again. And you tell them, well, you should really stop these. Yeah. Anyone who's been treated is not going to go, oh, that sounds great. And it turns out that even the North American Menopause Society has backed off this. They've said that no, you can take it longer. In fact, it could be good for you. So I can tell you how we approach it is get really on a good program and stay on it till the last day we're on Earth.
Mhm.
For example, is anyone going to be able to tell me that I should stop my testosterone somewhere along the line with how beautiful it is?
Yeah.
No, won't happen. And then the bottom line is the risks for everything not good are reduced. So for women, the risk for breast cancer, the risk for heart attack and stroke, and for dementia, taking hormones reduces that risk. The risk for men reduces the risk. So that being known, and then the most important thing of all is there's a phenomena all over the world, but especially in the United States, called assisted living facilities and nursing homes. Knows more about this than most every physician. And Holly, why don't you pick it up there and say why people wind up in nursing homes?
Sure. Well, we know that the perimenopause and the menopause symptoms, per se, whether it be the hot flashes, night sweats, poor sleep, what have you, those symptoms can last anywhere in women from about 3 to 15 years. And so, even if you just took them for that short time, well, you're treating some symptoms. The trouble is, though, menopause continues on, and we wind up with progressive symptoms and aging and disease progression, whether it be not enough hormones to support our brain, so we wind up with dementia, whether it be not enough hormones to support our bones, so then we really accelerate osteoporosis and falls and fractures that occur at way too young of age, that then result in rehab facilities, long-term care, spinal fractures, things of that nature, or whether it be progression of atherosclerotic vessel disease of the heart. I mean, if those hormones aren't present, we get continued age progression, continued disease progression that really could be slowed greatly. It's not going to stop it altogether, but the goal would be to have my hip fracture at 99 and not 69. So to try to prevent a lot of that aging and just really back it up so that we can be strong and live well, the hormones will sustain that for many, many years longer. And to take it for a short period of time is, I guess, it controls the symptoms for that period of time, but it's sure not preventing anything off in the future. And that's, I think, something that's missed a lot, and is so very beneficial to women and men.
And
And
to
then,
tell, yeah, go
when
ahead.
you look at how do women and men wind up in assisted living facilities, I've heard estimates, including from Dr. Papanek, that up to 80% of the women and men are there because of lost hormones. Women, when they don't get their testosterone, they wind up moving from cane to walker to wheelchair. That's quite a step right there. And then also because of loss of the muscle that holds up the bladder, along with the vaginal changes, they wind up in adult diapers, and then it's unmanageable to take care of many of them at home. So I've heard estimates 80% of all folks who are in nursing homes and assisted living facilities are there because of not having sufficient hormones.
Men as well,
This
I
is a
guess.
big deal.
Men
Uh,
too, or just women?
well, men, they also get loss of muscle called sarcopenia. It's the bane of the elderly. And so they move from canes to walkers to wheelchairs, among other changes. So there's, when you talk to someone who's going into assisted living facility, as I have, and gosh, Holly, you should really speak to this. They're willing to do it, but that's not what they want. They want to stay at home.
Yeah.
They want to continue in the life that they've designed for the most part. Would you comment on that, Holly?
Yeah, absolutely. I mean, let's look at men and their testosterone. When that begins to decline, they lose muscle strength, they lose bone. And so then when there is a fall, those fracture. And so they wind up in an assisted living or long-term care facility. When they don't have their testosterone, their heart ages. Testosterone is very protective for the heart. So then they wind up with a heart attack, congestive heart failure, heart dysrhythmias, and rhythm abnormal. That'll also put them in a rehab facility because the same time the heart is declining because there's no testosterone, the muscles are declining, sarcopenia, kind of that overall atrophy and decline. So you start to see kind of this tumble downwards that occurs in men and women. We all have the same hormones. We have them in varying amounts, but they're very beneficial to both genders. And without them, our body suffers and begins to decline in all areas.
I want to mention too, when the original question also was, how long should we be this, shortest period of time, true or not true? And just to add on to what Dr. Rosensweet said, would we take away somebody's insulin and say, you know what, enough, if you have, blood sugar levels or your
Right.
thyroid, we're just going to lower, get rid of that medication.
Right.
I mean, it just doesn't make any sense. Why would you take away the hormones if you're thriving on them and they're protecting you? Then yeah, that makes no sense. And another thing I'd like to add as well, because I think when we have the hormones, when we talk about hormones, like the three of us are, and people listening to this, they sound like a miracle. Like, wow, I just have to take that and then I'm going to be protected for life. Well, I want to remind people there are also secondary effects. Now, if you're sleeping better because of the hormone therapy that you're getting, well, then you're more likely to wake up in the morning with energy and go and exercise. We know exercise is protective of all these diseases of aging. We know that you're probably going to make better choices of nutrition because you don't have those cravings as much as you used to have. You're going to have a stronger immune system because of the better sleep. So just to remind people, it's, of course, when we talking about hormone therapy, we're also talking about the whole lifestyle changes that come along with that as a benefit for having the support of your hormones. So I hope that makes sense.
I love that, Zora.
Yes,
When
well
someone
said.
feels better, they tend to care more
Mhm.
about these core things like eating right and exercising because they want to, because they feel good.
Yeah.
That's so well said.
And by having those hormones supported, not to youthful levels, as much as we'd all probably like to be 29 again, we don't need to be up here fertile, those types of, but it would be nice to be here such that there's a little bit of a platform of your hormones around to support those activities that you're looking to do, whether it be the exercise or the sleep. So you're exactly right. You're really just sort of offering yourself a nice metabolic safe place to jump off from. And then the sky's the limit. But.
So I'd like to move on to a few questions that a woman who is interested in approaching hormone therapy treatment or just treatment overall for their menopause, whether they're thinking about hormones or not, what, as a physician, both of you are physicians, what are a few questions that you think they should be asking their doctors? Let's start
Well,
with Dr. Rosensweet. Yeah.
yeah, you that's the most significant question that I think a woman in midlife or a man in midlife can be asking. And it leads us to what I call shopping. It's like you want to spend some time and some effort to find someone who's really good at this and that you like. And there's various ways to do that because that's the most important thing. Find someone who really knows what they're doing in this field. Because hormones are powerful and they're complex, and best hormone therapy calls for a process of individualizing to the individual woman and man. Women vary enormously as to how much estrogen they want. Some need low amounts, some need high amounts. There's all the ones in between, and then you got the same thing with progesterone and testosterone. So you want to go to someone who really understands and has taken the time to get the extra education and has had some experience in this and is getting mentored if they're brand new to it, so that you get to have the expert treatment. And so the place you begin is you ask your network, your friends, because invariably a woman has got a friend or there's someone in their friend group is on hormones. And so you say, do you know someone who's really good at this? That's one way to start out. Another way to start out is, well, contact us directly. We've been training and physicians and nurse practitioners and PAs for decades. And so we have a network of physicians and nurse practitioners all over the country and now starting in other countries who are really getting great at this work, because that's what we care about, is getting people to specialize in this so they get really great at it. And then if that's not a resource, you go to your local compounding pharmacist. There's 7,500 of them in this United States. They're in every city. And what I recommend is that you actually go into the pharmacy. These are busy folks that if you call them, they're not necessarily going to take the time, but person to person, they will. And they'll be delighted most of them will be delighted to talk to you. And you ask them this question. You're fulfilling prescriptions for a lot of folks. Who would you choose as your top favorite and most knowledgeable providers that are treating women in menopause or men in andropause? And very often you're going to get a good lead because they know. They know from the quality of the prescriptions they're receiving and the level of individualization that the providers are doing, they know who the good ones are. So that's another resource. And then you can, again, contact us. We have people in almost every state now who are practicing our method, and we love our method. We think it's the shizness of all treatment programs. So
It
that's the
is.
most important thing you can do for as a woman and as a man. Go shopping until you feel that you've met someone that you feel you like their values, you like their training, and you feel comfortable with them.
These are great questions and approaches, let's say, for a woman to try to find a menopause doctor or a doctor trained in a menopause medicine itself. So there was the ask your girlfriends, go to iobim.org, Dr. David Rosensweet, he's got a list of people he's trained, or you go to your compounding pharmacist. These are three great ways to find somebody who's qualified. And just to reiterate that I've gone through the IOBIM, the menopause method by Dr. Rosensweet. So is Dr. Holly. It's incredible what you learn. And I'm super excited that you are training more doctors and you're doing so much to help women. So we really appreciate what you're doing. But I want to ask Holly, because you also receive and been treating women through menopause. You've been working for 25 years. And I'd love to know, when you have a patient who comes in, what are the three questions you think she should be asking you?
Ooh, that's a fantastic one. Um, I want to know a little bit about their history. So things that they're going to want to bring to me is, one, what is my training? They need to feel comfortable that I am expert in this area, because there are a lot of folks that have not been trained in this and they're doing it a little bit on the side. As long as they're open to that, I'm good with it. But they need to ask me what my training is, where did I get my training, and next would probably be, what type of hormones do you use? That's huge. They're not all the same. We are very individual as women, and what dose works for one woman can be completely different from what dose works for the next woman that you meet. So that needs to be, it needs to be a dosing, it needs to be bioidentical, that needs to be right off the bat. There are some FDA products out there, but they're oftentimes one size fits all. And that doesn't lead to the same titration and the individualization that's needed. And then probably the third thing would be, let's talk safety. Tell me about, some of the miscommunication or some of the information that you've heard out there. Let's start tackling that one by one. So let's just talk about hormones in general. What are the pros, cons? Bring to me what your concerns are with it. Just like you're saying, how long, shortest time, all those questions. I love it because there's great science behind all the questions, and I love to just kind of tackle those things. So
Oh,
that's kind of where I'd probably start.
good ones. Good ones. I wrote a
Can I
blog
add to
article.
that? Can I add
Yes,
to that?
please.
Um, at this time in human history, I think it serves certain women well, not all women, to know something about it, so they can learn from the office manager, who's usually the one they're going to be able to talk to, what kind of things are being done in that office. And one thing that you offer is a free PDF copy of our book, Happy Healthy Hormones. We originally wrote that for women, and so the more you understand, the more you're going to be able to have a conversation with an office manager to check out their criteria. Like Holly mentioned, are they doing bioidentical? Are they working with compounding pharmacists? Best case scenario, are they using organic oils, for example, is best stuff? What kind of testing are they doing? If there's a provider that's actually doing 24-hour urine hormone testing for women, they've gone a long way in their training. That one question reveals a heck of a lot about the level of expertise that provider has. But yeah, they can download from your site, right, Zora? Free
Yep.
PDF copy. The best thing is women don't have to learn a lot, that they just immediately link up with someone who knows what they're doing, that they trust. So like I go to my auto mechanic, he likes to tell me about what he's done. I say, no, it's okay. I love it that you know it. I'm turning my car over to you. You know how to do it. So, but some women, they need to know a certain amount to be able to have the conversation that's going to lead them to someone that they're really comfortable with.
That's so true. And I find that I'll have patients, some would just come to me and they say, I don't care, just help me feel better. And we just get rolling. And then I have others that have read his book and that have read Estrogen Matters, have a great deal of knowledge. And I love that too, because we can really get in there and get to, dig into the weeds of all the questions and such too. But it's a lot of fun all across the board. And I enjoy both those ends of the spectrum. It's a lot of fun.
These are great, great questions and a great preparation. And it's interesting, you do have the full spectrum. And I don't think if you're comfortable because you trust your doctor, absolutely. And they are trained, because I've had women with this attitude, like, just tell me what to do. And the doctors have biases. They don't like hormones and they're still stuck in the Stone Age, and they haven't kept up with the science. They're going to say, no, you don't, you not yet, you don't qualify for hormones, and that's it, period. And then you go home still feeling bad. And that's not right either. So I think it's get what you expect, trust your doctor, but also get treated and get what you expect. And I think that you deserve. We have a great blog article as well on how to prepare for that first visit to your menopause doctor. So I encourage people to go to that website, to my hackmyage.com website, and get that. You get Dr. Rosensweet's free book. There's just so many resources out there to help you. But I do like women who are a little prepared, so they can sort of self-defend if they do encounter a doctor who's a little bit biased, maybe not in have your utmost interest at stake. And that just happens. It's not all of them, but it can happen. And we do want women to feel better. So
You know what, Zora? You just asking the question triggers another important aspect to me. If you call an office and they discourage you about hormones, or they say, well, it's too risky, that's fine. but that's your cue to move on because that's not true. Although we're all at risk for all kinds of illnesses, hormones do not cause cancer, and people who are on hormones are at reduced risk for cancer. Yes, we're all at risk, but anyone who's got fear of hormones and says things like, well, we'll do the lowest dose for the shortest period of time, like you began this with. No, you can respect them. They may be doing really other good work, but they're not doing good hormone work, and they're not up on that hormones are associated with reduced risk. So if they say, well, we're a little nervous about, or you shouldn't be on hormones, say, oh, okay, bye-bye. Go on to the next one. It's a shopping trip.
Yeah. And yeah, get in touch with me and I'll put you in the right direction, even if you're not in the US, because we're really talking, you guys are both trained in the US and you train that, like you said, you are expanding, but I do want to help women all over the world. I had somebody from Namibia ask me, where can I find a menopause doctor? We found somebody for her. So don't fret if you're not in the US and you're listening to this. This reminds me of just got another question in my head that for some women I've met, they are concerned because they have breast cancer and they want to be on hormones. They hear all this stuff and they want a doctor that's trained in this area. Sometimes we get uh, women or I don't want to say practitioners of some kind, or people who not really have a doctor or a PhD or anything with their name, and they can prescribe hormones online, or they make their own formulas. You have some influencers creating their own stuff because you can get this stuff online. So, what would you say to someone who maybe perhaps this influencer person is treating a lot of people, but when you've got something, if you're quite concerned because you got breast cancer or family history of whatever, or you had a heart attack before, or et cetera, would you say that how would you tell a woman to approach finding a menopause doctor who has this sort of higher concerns?
Um,
Yeah, go with
let's
Dr.
go
Rosensweet.
for the science first. That
Right.
Yeah,
Right.
let's review the actual science first. And it comes down to this, and I already introduced this, that we're all at risk for all kinds of illnesses. We're at risk for hundreds of cancers. That risk does not just disappear. Women who've had breast cancer and have had that breast cancer properly treated, they have an increased risk of recurrence rate than a woman who's never had breast cancer has of getting breast cancer. But given that we're all at risk, a woman who is treated with hormones, who's had breast cancer properly treated, is at less risk for recurrence than a woman who's had breast cancer, had it treated, and is not on hormones. That's the actual science. Less risk of recurrence. Well, the next following question always is, yeah, but I had an estrogen positive receptor site cancer. And the answer goes back to this. A woman who's had breast cancer and had that breast cancer properly treated is at risk for recurrence, but she's at less risk for recurrence if she's treated with hormones than if she's not. And that's the science, which sort of makes the question, well, what about the estrogen receptor site? Not factoring in there. When you take an individual lump out of a breast that it turns out to be breast cancer, there's a lot of different cells in there. It's a real mixed bag. And some of them, to get technical about it, and you may want to interrupt me so I don't get so technical,
Go
but any
ahead, keep going, get
cancer,
technical.
any cancer that's a tumor has all kinds of different cells in there. It's got cells that when a pathologist looks at it under a microscope, it looks like normal breast tissue. It's not, but it's a variation, but it looks like normal breast tissue. There's also cells in that lump that don't look like anything, that if a pathologist isn't told that it came out of the breast, they could not tell where it came from. And those are the ones that they can't tell. Those are the undifferentiated real cancer cells out of control. They're the problem in any tumor. The well differentiated cells that are in there, that look and almost behave like they have estrogen positive receptor sites, but they're not the problem. The problem are the undifferentiated ones. So the bottom line is when you take the whole, and no one covers this better than Dr. Avram Blooming in a book called Estrogen Matters, which we hold as mandatory for any woman who has had breast cancer to read that book, Estrogen Matters, because you're gonna get the in-depth science. And Dr. Blooming is an oncologist who specialized in treating women who had breast cancer with hormones. And he's one of the few people who've run an ongoing study. And we've talked to him personally. We've raised this question over and over again. The science is women who've had breast cancer and had that breast cancer properly treated, if they're treated with hormones thereafter, they're at less risk for recurrence than women who who are not receiving hormones.
Super important. I had a comment the other day of a woman, she says she was 60 years old. She was on hormone therapy for a couple of years, got breast cancer. Her doctor stopped her treatment. And I'm assuming, I don't know, this is just a comment. I'm assuming she's getting treatment now. She wants to go back on. When is a good time for her to go on? And should she have stopped in the first place?
Well, the good time to go on is when you think about it. And you can link up with a physician or nurse practitioner who's really skilled in this area. And yeah, we go at any time a woman thinks about it. And, you don't want to look back so much, okay, the doctor got frightened because the full knowledge was not out there. No fault to the prescriber. You have to really dive into the subject of risk to know that the risks are less with hormones. You have to really do that. And so lots of women had interrupted hormonal courses. And yeah, I just say, whenever you think about it, go out there. And if you get a good provider, they're going to know how to deal with any additional risks you might have for a blank period of when you weren't on hormones. And yeah, we never say never.
Mhm.
We always say, when you think about it, go out there and do the shopping and reconnect.
There's something to be said too. A doctor is really well trained in this and knows how to treat a woman through the breast cancer and help her with the hormones, are probably looking at a lot of other things that are going on in her body, in her blood work, or her biomarkers of anything, because we can't blame everything on a hormone. I mean, if you wanted to, there's probably a lot of other factors that come into consideration. And whenever I look at the risk of anything, it's just when I consider smoking and obesity as being such high risk factors, modifiable risk factors for all diseases of aging, like why don't we focus on that? That's quite important. So hopefully doctors are also talking a little bit about those factors and how to help their patients as well, lower the risk for everything, and as while they're treating them through the hormones. So do you have anything to add to that, Dr. Holly?
Yeah, it's just so incredibly unfortunate for women. Hormones were demonized. We had years and years, decades where women were on them and they had such better overall health outcomes and such. And then there was that just inaccurate study in 2002, and since then there's just been this demonization of hormones, and women have suffered. We've suffered with different cancers, we've suffered with brain degeneration and dementia, we've suffered with heart disease now matching men. And it's just unfortunate. It's a lot of misinformation. Unfortunately, it's continually perpetuated. So thank you, Dr. Rosensweet, for continually being out there and training physicians and trying to get the science to providers. But it's an uphill battle. It's still kind of kept out of med schools a lot. A lot of our hematology oncology friends still go with that mantra, estrogen is cancer. It's just false. That's not up to date. And it was not even an accurate study to begin with, but boy, it was sure sensational and it hit the news. But we're so much further along than that. And there's so much good that can be done with hormones across so many organ systems that I hate for them to just be taken off the table. So I'm just thankful to be here and to be continually sounding that horn with Dr. Rosensweet to change this narrative.
And Zora, you bring up a very, very important thing. Like, there are causes to cancer. Absolutely, there are. And I like to think of it as this, that if we had a video of someone's life from in the womb till when they got the diagnosis, and we pressed a button and edited out all the good stuff, all the good food, all the exercise, all the family time, all the successful and happiness. We just got rid of all that footage. What would be left behind would be the thousands and thousands of challenges to human health that wound up creating illness and a weakened immune system, for example. And so these need to be attended to. Any woman that we invite into being treated, there's some criteria that we have. We want them to do what you're doing, Zora. In my initial interview with patients who've had breast cancer, I asked them, "Have you gotten down to some of the things that could have caused this?" Many of them are very well aware that one of the principal causes were the stresses of their lives, the emotional challenges that they didn't do well with. And what they've done is committed to a process of personal healing of their own emotions and their consciousness and their life. I mean, just to go a little bit far afield or right down to it, like yesterday, I was interviewing a patient that I've worked with for over 20 years, and she's been on hormones for over 20 years, and she had a bleed. And once we
Whoa.
sorted out the biology of it, she got a period. And once
Wow.
we sorted out the biology of it, I started venturing into what's going on in your life right now. And certain enough, there was a major challenge where she had gotten into a new relationship where she was being asked to surrender her power once again.
Hmm.
And I don't mind to get too esoteric, but I always pay respect to that. And she was really challenged by the ability to communicate. And oh yeah, the uterus is crying, the uterus is bleeding, a power center is bleeding here. We want to pay attention to the things that really matter, including the emotions and the life part. We don't develop a life-threatening illness totally out of the blue. There's really important reasons. So I don't want to get too esoteric there, but the other thing I want to bring up is there's some simple biology stuff. Like Holly and I, and one of our other partners, Jill, we just interviewed a world expert on preventing breast cancer. And, there's many things just related to simple health of the breasts. And any woman who's got increased breast density or anyone who's at risk, it's really important that they understand their vitamin D levels must be robust, that they should be on iodine, delivered by someone who really knows what they're doing with iodine and melatonin, not to mention brasiers and compression bras and breast health. There's so much that you can do to reverse things that are really harsh on the breasts. And really, so you want to do it all. And we even have a chapter in Happy Healthy Hormones, our book, on breast health. And you can dive deeper into that subject. Who wants to burn their brassiere? But, you might want to think about it. So there's a lot of good stuff that can be done to prevent recurrence. And like you suggested, Zora, you really opened the door to, okay, well, let's get down into health changing behaviors here.
Yeah, the real ones that we can so easily modify and are so impactful. Those little hinges that swing the big doors. And boy, really, what what doctor looks at you in the eye and says, "Well, how's it going in your life?" What's like that's amazing. You're a dream doctor. I hope you're training I know you are training the doctors to do this, but I hope they all take this on board because I think that would really make an impact for a woman who's felt like she's being heard and not just, oh, here's this or here's that, and let's just look, be quite sterile about it. So it's really impactful. That bedside manner, I think, is really, really important. And I have met just a few doctors in my life who actually do that. It's just probably two. And I've seen a lot of doctors all over the world for many things during my life and never had, there's just very few people like that. So I appreciate you bringing that up and Dr. Holly, yeah, if you're not doing it, make sure you do it too.
I mean, you think of the breast and how many
Yeah,
women have been taking too much care,
yeah,
giving away too much of their energy. And I'm not saying that's the cause, but it's something to look at. Uh, I'm just sticking a fingernail into that whole subject, but invariably there's a lot of stories in there, and they
yeah.
lead to they can be the turning point. I've had turning points in my life that inspired me to heal, heal, heal. Boy, just go on a healing journey, and the rewards are enormous. And sometimes it takes a life-stopping event to open us up to, oh, we've got another project to do. It's called Healing My Being.
Yeah.
And what a great path that is. That's as rewarding as you can get because it can lead you to health and happiness and love and fun.
Absolutely. Oh, I
And
love
Zora,
it.
this
Yeah.
is why we're here, Zora, because he is the best. And he's training folks that want to be exactly like him. So, like I said earlier, he is the GOAT, as my teen boys call him, the greatest of all time. So it's just an honor to kind of be mentored by him in a large group of others, a lot of practitioners. So I'm grateful that we're going to try to carry this on.
Oh, that's wonderful to hear. Thank you, Holly. I'm only on question 3. And I still have a whole list, and we got to wrap this up. We only have time for maybe 1 or maximum 2 questions. I would love to explain to a woman who's just getting in this space in terms of getting her hormones sorted out, curious about hormone therapy. What can the majority of women expect when they get their first prescription of hormones? And we did cover this. You covered this really well in your menopause method program, Dr. Rosensweet. But maybe you want to reiterate, well, at least bring it to light. What should she expect?
Holly, how about if you pick that up?
Oh, sure. So, do you mean in terms of the treatment itself, the package, or do you mean kind of the symptoms and what you should expect kind of timeline?
Well, no, and yes, any either way, she's got her
Okay.
first prescription in her
Okay.
hand, and her expectations are probably pretty high. Like, I'm gonna sleep well tonight, or I'm gonna start losing weight, or I'm gonna whatever, symptoms she has. So, yeah, what do you think she can expect once she's got that prescription in her hand?
Okay, very good. So I guess I'm going to have to start by saying this is so individual. It's unbelievable. So women come with many of the same underlying symptoms, but oftentimes they'll have a little something different here or there, and that often will dictate Dr. Rosensweet and my kind of our starting therapy and kind of what that looks like. Once we meet with you, though, we'll talk about the hormones, kind of what each one of them does, and some of the benefits that you may see for each one. Typically, we'll start folks with progesterone right off the bat, the estrogen or biased, and then testosterone as well too, sometimes with some DHEA. And we'll go through each of those. We'll talk about some of the high things to watch for. So if the levels if the dose gets a little robust, or if it's a little on the lower side. But I guess I should also say that it may not be sleeping that night, especially if your body hasn't seen hormones in maybe even many, many years. A lot of those receptors go dormant, and it can take a little bit of time to kind of incrementally to kind of dial those up and wake those up again. So I'll say for some women, they'll say, gosh, within the first week, I started to notice some changes, and they can be very subtle. And then others, it can take a couple weeks just because maybe their body hasn't seen hormones in quite some time or kind of awakening things. Working with your practitioner, usually you'll have a follow-up appointment within that first 4 weeks after they start you on a plan. And then that's another time to really dial in, look at the symptoms. Well, I didn't sleep well here, and really kind of dial in those doses specifically according to that woman. But it is so individualized. But that's kind of the trajectory. Usually within the first 3 to 6 months, you meet rather frequently to really get things dialed in. Then typically by about 6 months, women will kind of come to us and they'll say, I'm starting to feel a little bit more like myself. And that's an exciting time because that's when we'll usually do our 24-hour urine and really see where we've kind of fallen into and then kind of adjust from there. And then typically it's kind of more smooth sailing after that point. But that's maybe kind of a timeline that I've seen. Dr. Rosensweet, do you agree with a lot of that?
Yeah, I certainly do. It's an individual thing. You know, some women in the perimenopause that are starting to not sleep and they're getting mood issues and some hot flashes. I've seen results happen within the first week where they're going, wow, this stuff is powerful. And yet in other cases, when it's been a couple years that women have not had hormones, as Holly was saying, it takes a while for things to readjust. 80% of women who go into menopause have life-stopping symptoms, small, medium, or large. And those women, sooner or later, just like Holly said, they start feeling like, oh my God, I'm myself again. That's the statement we're all looking for in this field is, oh my God, I feel better. Some of the changes, they take a little longer, like if there has been change in vaginal health. We think in terms of 3 to 9 months for recovery, but recovery is one of our goals and expectations. And so it's variable, like the Holly said. Some are pretty immediate and pretty dramatic. That's fun. But the long-term things, sometimes it takes longer, and those long-term things and those deeper things are what even matter most to us. And people don't necessarily aren't aware of that, but protecting the muscles so that people don't go from canes to walkers, and people don't know that this is happening. Protecting the bones that are so crucial, protecting the heart. These things aren't necessarily noticed, but these long-term things are what we as physicians who see people at all stages of life, we think these are some of the most significant things. So it's variable. I don't know if I've added anything to what Holly said. It's variable. And then the women that I'm most concerned about are the women who have no symptoms, because 20% of women go into perimenopause, menopause, they don't feel a thing. They're looking around going, what's this big deal called menopause? They're the ones I'm most concerned about because they have the same losses to muscles, to bones, to vagina, and even to cognition than other women do. There's no difference in that loss process. So we want to learn how to inspire them that, hey, listen, it's great that you're not your life isn't stopped by symptoms, but go after the same excellent program so that 20 to 30 years from now, you're not going, oh my God, I have to go into an assisted living facility.
Yep.
Yeah, and I'm 65, 70 years old. I mean, we see so many young folks that have been without hormones for so very long. Just the disease progression is pronounced. And again, this is not exactly the potion to live forever. That's not our goal, boy. But it sure is to live well while you're here and to be active and be able to hang out with your grandkids and still go on the hike and be able to not wear adult diapers when you're with your family and you're 80. Like, okay, 99, maybe I need that at that point, but gosh, while you're here, be well and live well and be active and be able to do what you want to do, and hormones will help protect that.
We need to, it's hard to imagine ourselves as a 70 or 80-year-old if you're only in your 40s and 50s. But if you're lucky, you'll get there. And I interview women all around the world, see the 1-minute reels I do, and it's just share your menopause experience. And when I talk about their muscle, any changes or bones, when I get to the question about bones, have you checked your bones, bone density? They say, no, I don't have any joint pain. And so then I worry sometimes these are silent killers, right? When we talk about osteoporosis and then a fracture and then a fall, and then it just spirals out of control there. So, and I just spoke to a friend of mine several months ago, she's 65. She was on hormones. Doctor took her off for 10 years and something like that. And she wants to go back now. I said, it's a good conversation to have with your doctor, because of course she hears me all day. And she just a week ago, she was out with a friend, tripped on a stair, fell and fractured her hands because her bones were just too brittle. And she's now so upset because her doctor took it off, and she's wondering perhaps she wouldn't have fractured. Now she had an operation and all of this stuff. And who knows, because when you say that, oh, I don't have any joint pain or my bones are okay without even really testing or not knowing, uh, you may be surprised by the time you're 65, and then it's kind of late. And not that it's too late to start hormones, but you've already fractured, right? So again, a silent killer, a silent disease that comes on, you don't feel it, just like your heart. You don't really feel these things until you have the heart attack. And again, I encourage women really to, especially, like, 100% agree with Dr. Rosensweet. If you are asymptomatic, I'm most worried about you too, because you will not do the work that needs to be done to protect your bones, your brain, your heart, your vagina, breasts, everything need to be done, whether you're on hormones or not. Sorry, just do it. So yeah, no, I'm glad you both brought up these points, super important. I'm gonna have to let you go. We're gonna have a part 4 to get through the rest of my questions. It's horrible. I love these conversations. It's so easy to talk to you. And I think it's really, really important that women hear the science, hear your experience. I mean, the science is one thing, and I'm all for the science, but I don't care about science if it doesn't apply to you. The most important person in the room is you. And that's where clinical experience is really, really critical. So you want to have a doctor who is trained in menopause medicine. And we're here to help you. If you're listening and you don't know where to go, get in touch with me. I can put you in touch with Dr. Holly and Dr. Rosensweet. We've got links in the show notes where to get the menopause method course if you're interested in that, the website, Facebook, Instagram of all these wonderful people, the free book, Happy Healthy Hormones by Dr. Rosensweet, and a lot of other resources. And before I let you both go, are there any events or programs or things coming up that you'd like to share with us? Dr. Rosensweet, I've always starting with Dr. Rosensweet. It's an automatic
Well,
reflex.
the most exciting thing that's happening in our lives professionally is we're getting a major uptick in people who are providers who are interested in this field and are interested in specializing in it. And there's even a franchise company out there that's got over 100 franchises that in the Midwest and in that they're going to be offering, they're going to specialize in treating women in menopause and men in andropause. And this is the most heartening thing for me. It's going to get easier and easier and easier to find really skilled providers. And it's the other breakthrough is the cost effectiveness. Because we've trained so many, and we're working with the national pharmacy as well, the cost is getting much reduced in the United States, and for the rest of the world, we care about you. We're working on it. We're working on Canada and Australia right now, and the United Kingdom. So if you have providers if you're in somewhere in Africa, for example, there's physicians there, and you just send them our way. We're very interested in really training them up on getting really good at this work.
Excellent. And Dr. Holly, is there anything else going on in your world? I'd love to know.
Yeah, thanks. No, I'm just so grateful to be here. I'm grateful to have studied under Dr. Rosensweet for so very many years. And it's been so much fun watching this evolve and just the amount of practitioners that are coming on board. It's so wonderful. Women are demanding better health. We're not happy sitting aside and being told there's nothing to be done anymore. And you'll just have to be miserable for the next 50 years. That's not okay. And women are standing up and they're demanding better care. And I'm just grateful to be a part of this and a small part to be able to provide that. So it's been a lot of fun.
Where can people find you if they want more information or want to work with you?
Yeah, certainly. I'm under the IOBIM, just like Dr. Rosensweet. And so I'm in the US and I'm available. My practice is exploding and I just absolutely love it. It's the most rewarding work I've ever done.
Excellent. And so I will have links. You'll send me those links in the show notes. And are there any last words that you have for a woman going through menopause, Dr. Holly?
Gosh, just be an advocate for yourself. Seek out a provider that will work with you and provide you bioidentical hormones in an individual manner. It's life-changing, life-changing.
I have final words as well. We understand that women can feel really like their life is really deteriorating, and then you can feel really bad in a lot of different ways, including mentally going nuts. We've seen that, and losing cognition, and you can get really discouraged midlife from the loss of these hormones. And men can get really discouraged. They lose that erection, they lose their drive, and they can, when you're sitting in that and that's happening to you, it can be really discouraging. But here's the good news. Almost everybody, I don't know of a case that we've worked with that you don't get so much of it back to where you go, oh my God, I'm myself again. And then you get to cruise. It's not like you won't, like Holly was saying, it's not like you're going to not necessarily be immortal or not age, but you can have a very productive life, including a very active sex life. Think about that. If you have any interest in that, I know people in their 80s that are really having some of the best intimacy experiences they've ever had. So even if you're not feeling well and you're feeling desperate, just know you get on the right program, and you take care of your health, like Zora was suggesting there, is not just hormones. You can feel so good, and then you get to do the other good things that you're so interested in, like Holly was saying. Like you can get down there on the floor with your grandkids and take advantage of all the knowledge and wisdom and experience you've acquired so that you can once again play an active role in being our part in the generations where we're supporting the younger people, and they don't have to reinvent the wheel around life. So this is a big deal. And you talk to the people who have had this success, and you're going to hear glowing reports just like you do from us about wow, I can live a long life like and be very, very active well into my, until the time it's time to leave. Okay, not on earth necessarily forever, but even
I
if you're
love it.
down, and that's what my real hope is, that I wanted to say is, even if you're feeling awful, and when you're feeling awful, you can't actually imagine so well that you could feel well. But so many times that awful is got a big, strong foundation in low hormones. And so you can move from there to feeling, oh my God, I'm good again. I'm myself again.
You're absolutely right. And for the women who are rolling their eyes thinking, oh, sex, libido is shot out the window, that's the last thing I'm thinking about. I want to remind you that in gerontology, we studied the intimacy and sex among older adults. Yes, they want it. It's not like you age and it goes out the window. If you're happy with your relationship, a low libido, like whatever, that's your choice. But if you learned about the Harvard study of adult development, you may learn that the biggest impact to living a healthy, happy life was not quitting smoking, was not exercising, was not your diet. It was having strong relationships, tight bonds, and intimacy is part of that. So just to remind you, I know you may not be feeling like it, but that's what the hormones are help us to do, to feel like ourselves again, to feel that we can have these intimate relationships. So I really want to put, that sex and intimacy in importance to that. And it's just hard for some women to imagine when you are feeling like that, but it's important. So anyways, I'm going to let you guys go. Thank you so much for your wisdom and your tips. I just, every time I have you on, I learn something new. So I really appreciate all the work that both of you are doing. And I will hopefully see you again for another episode.
Zora, it's always a pleasure to co-create this with you. And so anytime we're
Yes.
here to do it again. It's a team
Thank
sport.
you. Yes, thank you so much.